A betrayal of the worst kind. That's how the Health Secretary today described events at Mid Staffordshire Trust. Announcing a range of measures in response to the Francis inquiry, Jeremy Hunt said everything must be done to give patients the high-quality, compassionate care that they deserve. This will include nurses being trained to wash, dress and feed patients and a statutory duty of candour, ensuring mistakes are revealed. But has the government gone far enough? Here's our health and social care correspondent, Victoria MacDonald.
This is where it all started, Mid Staffordshire NHS Trust, and with the deaths of hundreds of patients. But today the government said changes needed to be made across the entire NHS.
I want mid-staffs not to be a byword for failure, but a catalyst for change. To create an NHS where everyone can be confident of safe, high-quality, compassionate care.
So in their response to the Francis report, the government has set out a raft of measures, including changes to the way nurses are trained. The lack of compassion for the patient and professionalism of the nurses was one of the most heart-rending findings in the Francis report. Now nurses will have to spend up to a year helping patients eat, wash and dress, in effect doing the job of a healthcare assistant before they can qualify. Debbie Sandringham trained as a nurse in the 1960s and retired 10 years ago, a year early. She said she was fed up with how standards were slipping.
The standard of nursing had gone down considerably in the 14 years I was there, both in the care of the patient and in the general cleanliness of the hospital and the food.
And so today she welcomed this move back to the basics of nursing.
I feel that's absolutely wonderful. It's exactly what should have been happening all these years. It's no good going to university, getting a degree if you don't know how to wash somebody properly, because that actually is the basis of all nursing, and that's what's going to cause them infection and possible, in the end, death.
Yet today there were few details on how this would actually be achieved, and the opposition criticised the government for failing to include a Francis recommendation on minimum staffing levels.
We will never get the right culture on our wards if they are understaffed and overstretched. But there is evidence that things are going in the wrong direction, and the Secretary of State was silent on this today.
Other measures announced today, some more radical than others, include a new Chief Inspector of Hospitals. Failed NHS managers will be barred from holding posts. There's to be a ban on gagging clauses and possible criminal sanctions against trust boards if they withhold information. Robert Francis made 290 recommendations in his report published last month, and it's quite clear today that the government has not responded to every single one. And in fact, as I understand it, the coalition partners were negotiating right up to the wire on some of the more legal aspects and on what should be included and what should be left out. But today the Health Secretary said what had been important at this point was to ensure that they got the spirit of the report right. And in what amounted to a U-turn, the government promised a statutory duty of candour, meaning organisations, though not individuals, would have to reveal when something has gone wrong.
We saw gross examples of cover-up at Stafford, and I think that had a great influence on Robert Francis. And that was from lawyers and managers, not from the health professionals themselves. So the corporate duty is vitally important in bringing about that patient safety culture, one that doesn't tolerate cover-ups and denial, and also supports and protects staff in doing the right thing.
Yet overall the response today was at best muted. Those who lost loved ones at mid-staffs, for instance, were left feeling so much was still missing.
I'm a little bit disappointed, to be honest. We wanted much more from this statement. We wanted to ensure that people weren't going to suffer again like my mum did 5 years ago. Nothing really tells me that they've accepted the disaster that's gone on in the NHS and is still going on in the NHS.
There were 50 missed warning signs at mid-staffs. It was, the Health Secretary said today, a betrayal of the worst kind. And he said this was just the start of a fundamental change to the system. Those who were bereaved will be watching.